Hi, today I'll be discussing about the blue ocean of Metaverse social prescribing. And this is the agenda for today. So let me ask you a question first. Why treat people and send them back to the condition that made them sick? A very powerful quote from Professor Sir Michael Marmot. So currently the current health system is geared toward providing treatment once a person becomes unwell, instead of providing preventative treatment to the patient so it doesn't escalate to a hospital admission or even to a GP visit. So one of the things I want to focus on is that in 2015, 20% of GP consultations were for non-medical reasons. And it all comes down to the social determinant of health. And basically, these are anything that are not part of a clinical record, but could have a profound effect on the patient health and well-being, which could be, for example, unemployment, bereavement, housing situation, not having an education. And one of my favorite definitions is from NASP that states that social prescribing is supporting people via link worker to make community connection and discover new opportunity, building on individual strength to improve the health and well-being of the patient. So this is quite an interesting concept because many people misunderstand that social prescribing is signposting someone to somewhere else, but that is not the case. And also one of the important aspects is link worker, which is a new job role that's been in existence for several decades, but only started to gain mainstream attention lately in the past few years. It all thanks to the hard work of pioneering work of Dr. Michael Dixon and Broadmead Bible Center back in the 1980s, which basically is someone that requires active listening, empathy, and creativity to be able to listen to the patient to create a care plan based on what matters to them. So you're shifting the conversation to what's the matter with you to what matters to you, putting their need at the forefront before creating a care plan for them. So social prescribing is not active signposting. It's about creating a care plan which can involve different elements such as housing support, financial advice, and of course, gambling addiction support. So one of the things I want to focus on is the socially connected part, because when I found out 6 years back that when someone is socially isolated, that is the equivalent of smoking 15 cigarettes a day, I made it a commitment to raise the profile of social prescribing to the health and social care sector, more specifically the pharmacy world, because I'm a pharmacist. And all comes down to the concept of Maslow's hierarchy of needs, because if you look at the bottom two, those are external factors. For example, the government can help you with housing, food ratio, and also with electricity to make sure you don't get cold during winter time. But then if you look at the top three, those are more internal factors. I cannot go to the doctor and say, can you please prescribe me some self-esteem? Or can you please prescribe me some self-respect? It has to come from within me, right? So in UK, there's a concept of PAM score, which is patient activation measure. And this is looked at to look at the improvement of the patient ability to take ownership of their life and take ownership of their life condition to make significant improvement to it. This is the link worker model used in UK, but I want to focus on the orange part, which is about creating a personalized care plan based on what matters to the patient. And those are some of the studies that's been shown that across 3 years with 4,000 patients, there's been a return on investment of 43p, which is very significant. Bearing in mind, in UK is about 66 million people, and about 20% of the UK population has a long-term condition. So this is what kind of prompted the UK government to put more funding behind it. Because as a result, if you think about it, by making sure you don't escalate to the state that you become unwell, where you require GP visit and A&E attendance, this costs money, this saves money for the UK health system. Therefore, it's an incentive for the UK government to put more promotion behind this initiative. So, which is why they launched the NHS long-term plan, where they've already recruited 1,000 link workers. They're looking to have at least 1 million people benefiting from a social prescription referral, and at least 2.5 million people benefiting from the personalized care, which is why those two organizations are very welcome addition to the health system. For example, you have the National Association of Link Workers, which is a professional body of link worker to share best practices. And then you have the Personalised Care Institute, which is an online learning platform to educate the existing workforce on social prescribing, shared decision-making, and personalized care. So this is the current model of care in UK displayed as a triangle, where the bottom one is mainly applicable to everyone that can benefit from social prescribing referral. And then you have those at the top that needs more complex need, which can benefit from a personal health budget. And basically, PHB is a pot of money offered by the UK health system to assist you with any cost that could be travel to the gym classes, money to help you with the cost of your electricity, housing bill. And from the latest annual report from NASP, they were first of all launched back in 2019 with £5 million of funding from the UK government. And as a result, they were able to fund at least 37 organizations with nearly £1.8 million, where each organization was saving up to 50,000 to elevate and improve the efficacy of the project, which are a very welcome addition. Another concept I want to focus on is that social prescribing is applicable globally. So there's this startup from America where they were valued at $1 billion evaluation, and all they do is provide PAs to senior citizens. They don't call it link work over there, they call it PALs, and basically look at alleviating social isolation for the senior citizen, which is a incentive for the American health system to work with them, especially for insurance. And then in order to capture the information of the patient benefit from a social prescribing referral, there's a concept of DSP, digital social prescribing. So one of the leading company in UK is Elemental Software, and those are the latest metrics. They were able to help at least 1 million people, as in visit, 200,000 patients were benefiting from this platform, 22,000 healthcare professionals, social care professionals are using their platform, and that's just one company. Can you imagine if there's a company like this in every single country across the globe? That means everyone in the world will be able to benefit from social prescribing and be able to improve their health and well-being without relying first on medication. And taking reference from the United Nations Sustainable Development Goal, one that's most relevant to social prescribing is SDG 3. And from the WHO report, it's been shown that by 2030, there'll be a shortage of 18 million healthcare workers, which is very, very significant. So that means the current level of care is not sustainable. We need to shift our approach from a reactive one to a proactive one, preventing the person to become unwell in the first place. So this is why Carl Presch was able to discuss the benefit of social prescribing alongside James Sanderson and, of course, Ron Schwartz at the G20 Summit last year. They also launched the Global Social Prescribing Alliance with partnership with different countries across the world in their playbook. And the one that's most relevant to the Metaverse and the theme of wellness is harnessing digital solution, which I think Metaverse could be a great addition to that. And also the concept of digital twin of SDG cities. So there might be many people with very bright idea, but are not able to implement it because they don't have the funding to make it happen, or business cases, or expertise. But being able to create making use of the digital twin of a city and make feedback on how they can improve the infrastructure to promote healthy living, that would kind of reduce the barrier of entry for enthusiastic healthcare professional, social care worker that wants to get involved in the development of cities to make it SDG city ready. And you might think that social prescribing is a niche market confined to UK, but it's not. Lately, it's been getting global attention. For example, there's like social prescribing pilot happening across the world. For example, South Korea, Japan, India, Canada, Singapore, Sweden, Australia. And Australia, like in Canada, they launched this year the Canadian Institute for Social Prescribing, which showed the commitment for certain countries to really get behind this amazing blue ocean of social prescribing, and also, in my opinion, the Metaverse. This is one of the, I guess, most exhaustive document article on the global social prescribing initiative across the globe, which I highly recommend everyone to read if you want to learn more about this. So when I first came across this article back in March, I was very happy because it kind of demonstrated the benefit of the metaverse for the existing pharmacy sector. Because back in the days, back in 1970s, we only had brick and mortar pharmacy. Then came about the invent of the internet, which kind of allowed the rise of prominence of online pharmacies. And I believe now, thanks to the metaverse, I know several futurist visionaries, the rise of metaverse pharmacy or meta pharmacy is just around the corner. And Savers Pharmacists taking the initiative in doing that. Then you also have a Canadian pharmacy that opened a pharmacy in Decentraland, and also another one in Sweden. So when I was approached by one of my contacts in India, he was very keen to organize a meta pharmacy hackathon, which eventually happened back in July, which was an overwhelming success because I was blown away by the quality of the content of the pharmacy student. And that was the first of its kind, right? So I highly recommend pharmacy students to organize more of those meta pharmacy hackathons across the globe to fasten the adoption of meta pharmacy. So this could be one of the most beautiful design in the pharmacy, in my opinion. But then you have to think about why make a replica of a pharmacy in the metaverse when you can do so much more? How about a cyberpunk pharmacy? How about a space pharmacy? So those were examples of pharmacy metaspaces done with those three tools. So instead of making it a real life replica or digital twin of existing pharmacy, why not release the creativity of the environment designer to include the cyberpunk city, a space pharmacy, ocean pharmacy, to really make it more welcoming for people that wants to attend a pharmacy in different environment, right? So there's this concept of green social prescribing, which is basically a walk in the park. And as part of the Fractal Hackathon F100 and Solar Reptile Hackathon, I was able to create a project called Fractal Fantasy, which is an example of Metaverse green social prescribing or meta green social prescribing, which the person can attend his virtual space to just have a walk virtually to improve their health and well-being. So that was just I guess, immersive experience I created, almost like as a proof of concept. Then also is this concept of meta blue social prescribing, whereby instead of being green environment, I'll be blue environment like the ocean. And also meta black social prescribing, which is meta spaces in space, taking advantage of the overview effect to improve the health and well-being of the patient, to make them realize on how fragile the earth is and realize that the problem that they might have may not be so as big as they might think. And this could help people be unstuck in their current situation to move on with their life. When I did a social prescribing podcast with both Aragon and Shea, then I was able to come across very insightful feedback. And one of them was the concept of a drone delivery, as in the avatar of the patient can pick up a medicine from the meta pharmacy as an NFT registered into the health record, and then the medicine get delivered to their house via drone. And in July, there was a pilot that was done by Boots, which is the largest pharmacy chain in the UK. And this kind of validate the proof of concept of drone delivery after selecting a medication in meta pharmacy. Maybe not the first part, but definitely the second part. So this is a very good article on meta health that kind of introduced me to the concept. And Dr. Jane Thomason also released an article discussing about social prescribing application in the metaverse. And those are current Web3 stakeholders. And those are existing videos of company looking to improving the health and well-being is via Spaces. And this is another platform which kind of include existing startup with providing the health and well-being improvement of patient using the digital space. And as you can see, digital health could be abbreviated for the metaverse as meta health, digital medicine for meta medicine, and digital therapeutics as meta therapeutics. And some of the opportunities are, of course, the metaverse therapeutics, metaverse health formulary, and of course, metaverse determinant of health to improve the health and well-being in a metaverse for patient. So those two organizations are very welcome addition, the Metaverse Standard Forum and the Open Metaverse Alliance 3. And let me quickly show you a demo of the work I've been doing in collaboration with Mark. So as you can see, this is a chatbot as an avatar representation. And that's literally just a proof of concept, just to kind of get you an idea how this could be expanded. And that'll be the end of my talk. Thank you.